Good evening. Welcome to the campus of Ouachita Baptist University in Arkadelphia, Arkansas. I'm Lewis Shepard Jr., Special Assistant to the President here at Ouachita. Tonight, we're honored to facilitate a program entitled Black, Brown, and the Challenge of Dying Well. Arkansas Hospice is presenting the program, which is made possible by a grant from the Russellville Fund. What is Black, Brown, and the Challenge of Dying Well? In America, African Americans, as well as Hispanics and other minorities, are at risk of not dying well. Historical lack of access and substandard health care over time has led to the general sense of mistrust in many aspects of our modern healthcare system, including the understanding and utilization of hospice care. But change comes with understanding, knowing that hospice care is and how to assess it can help our minority populations and their family to receive the comfort and that respect they deserve when facing life-limiting illnesses. This workshop is designed to bring awareness to all of our communities about the problems and available solutions for minorities and the end-of-life healthcare. Tonight, we are joined by panelists who have worked in this particular area of life and the end of life and experienced practitioners who have helped people to die well. Our panelists are Pastor Raul Torres, President of the Main Street Mission, Senior Pastor of the House of Restoration in Dardanelle, and Ms. Sharon Ausler, an LPN, Hospice Advocate, and active with Better Life Ministry. For those who are unaware, the history of hospice in America is very brief. It's only been a part of American life since 1974, but it goes back to the 11th century, to the Roman Catholic Church. And the word hospice comes from the Latin word hosp, which means both guest and host. And this was a place for pilgrims to come and to find solace at the end of life. It was in 1974 that Florence Wald and two pediatricians, a chaplain, founded the first hospice in the U.S., the Connecticut Hospice in Branford, Connecticut. So we have a very rich history, even though it's brief, but it's fulfilling and helping people to understand the art of dying well. Tonight, I will begin our first question. And if you have questions that you would like to have answered on the program, you can go to contact us at arkansashospice.org. That's contact us at arkansashospice.org. First question that I have this evening for our panelists is share with us your hospice story and how you, as the minority, first encountered hospice care. Pastor Torres or Ms. Ausler, who would like to go first on that question?
Ladies first.
Okay, thank you. Yes, I worked as a hospice nurse when I began my travels in Florida. And I worked for 3 different hospices there in Florida. And that was the first time I had ever dealt with hospice. And I learned very quickly the meaning of dying well. Because as a nurse since the age of 18, I learned that as minorities, there weren't a lot of hospice patients, that I would go into their homes or in the nursing homes or hospitals or where they were. And I would see that, and I would ask questions why minorities didn't accept hospice as well as other people. And I soon started asking questions, and as working as a hospice nurse, and then I went into being a triage nurse, And so 90% of the time when my beeper would go off, I was going to a death at someone's home. So I soon started to see that more and more minorities were not involved in hospice. So I wanted to understand why. And so I just started asking questions at family homes that were with the regular part of the nursing care. And that's how I learned that there were some barriers between the minorities and even the word hospice. But I love being a travel nurse. I love working for hospice. And I found great joy in making sure at the time of someone's death that I was present and I was there to help. And it wasn't just for the family or the person dying, it was for the whole entire concept of what death and dying that they were going through. So that's how I became involved in hospice care.
Yeah, when we first moved from Portland, Oregon to Arkansas, we moved to Russellville, and I was looking for a place to connect with the community, a place to serve. And we started going to a hospice, and I was very surprised. As a matter of fact, I was shocked. I didn't have an idea what a hospice was. As a Hispanic, it's something that we don't talk about it. Me and my wife started volunteering, and I'll be honest with you, at the beginning, I was thinking, this is not for me. You know, this is too hard. I don't want to deal with this because I wasn't prepared to deal with dying. It was quite an experience. My wife continued volunteering at the hospice, and then he started talking to me, you know, and she started motivating me to go back. She started sharing all these stories, you know, how people need help and how there is another world, you know, that we're not even aware of it. So I went back again, and I started having it, really enjoying it. You know, there is a need out there, and there is things that we don't know about it, but it was something completely new for me. I really enjoy it after a couple of years, and then I start going into the ministry, and then I still dealing more with these issues of dying and taking care of people, and I started working as a chaplain in the community, and it's a totally different world when you connect the chaplain, the hospice, and the ministry, and I really enjoy doing it, and I see a big need in the community, especially in the Hispanic community.
Thank you. Our next question, and again, for those of you who would like to send in questions, you can do that at contact us at arkansashospice.org and put your questions in and we'll get to those. Second question that we would like to deal with this evening is, in your experience, how have minorities traditionally perceived hospice care?
I can address that. That is a topic that as a Hispanic, we don't talk about it. That is an absolutely not a subject that you can discuss with your grandparents or your parents. As a matter of fact, they will get upset. You know, I mean, it's something that you don't have a choice. You know, they will say things like, hey, if you don't want to take care of me, that's fine. But it's because of lack of information. You know, I mean, helping somebody on those very important times in life, I mean, we need to be informed. What happened is I went to a Dardanelle Chamber of Commerce, and Arkansas Hospice came, and they shared for about 25, 30 minutes. After I left that Chamber of Commerce meeting, I went and talked to my wife about it. And I said, you know what? This is very important. We need to talk about it. You know, there is a need in our community. Because one more time, I mean, as a Hispanic, it's a no. Why? Because we don't have the information. We're not exposed. You know, there is a need, and there's nothing better in life to help somebody at those very, very tough moments in life. So getting the information, the right information. There is things like the worst place to go is the hospice. Where do we get that? Just because somebody said, our grandparents or somebody had a bad experience. But when we got the information, it really helped us. As a matter of fact, my wife is thinking to go back and volunteer at a hospice in Russellville. Thank you.
Ms. Ausler, do you have a response and a perspective from the Black community?
Yes. Hospice is taboo to us. It's something that when you say hospice, you say murder. It's that serious in the Black community. I don't know where the concept came that if you go to hospice, you're going to die, especially when the diagnosis that your loved one has is a terminal illness. They have a terminal illness. And it doesn't mean that when hospice comes in, that in 3 to 4 days, you're going to be dead. But Black Americans believe that. So just like the Hispanic community, we are taught and brought up to take care of our family. So anything outside of that family being taken care of by us is a no-no. I have a sister who's in a facility now, and my family is looked down upon that because we had to make that decision. So we have to understand, as we go into doctor's offices, hospice needs to be talked about. The doctors need to talk to the families about it. There has to be someone of authority that can bring the light to minority communities to say, this is okay. This is what they provide, and this is how they give it to you. But when no one is talking about it, especially in our communities, like Pastor Torres says, they don't want you to talk about it. You can't even discuss when I die. They don't want to hear that. My children do not want me to say, when I die, this is what I want. And we understand that there's life and we understand there's death. But as a Black person, it is very taboo. And we have to find a way to retrain the Black Americans and all the minorities in the understanding that there is a way to die well.
Thank you. In the classroom, we've called that dreaded conversation about death and dying the horse on the dining room table. And in my experience of teaching death and dying on the college level, I've never had a final exam for the class, but I asked students to prepare their death certificate, the announcement for their funeral service, to map out their funeral program, and to write their own eulogy. I've had students in the past that tell me, no, we could not discuss this. I tried to talk about it with my parents, and they absolutely refused to do so. But then there were some who really caught it, and they said, you know, my parents said, I need to do the same thing. I need to get all of this done now, and grandparents who were doing that. So it's a matter of education for our communities to get them on board. Let's go to our next question, and it is, how do we address issues of access to hospice care for minorities? How do we address issues of hospice care for minorities?
Well, in our community, I believe that through the churches is our greatest avenue, because that's where you're going to find a lot of people that are open and free to know what's good for them. And so I believe the churches, the pastors, the ministers, the deacons, these people have a lot of influence on the people and the decisions that they make. And we should get into groups or organizations that are led by Black African Americans, and to penetrate them with hospice information. And we have to get the people that are in charge to first agree upon it, because if they don't agree upon it, they have influence on the people. So we have to get to the leaders of these Black organizations, and we have to talk to them and educate them so that when hospice does come in, that the people will be receptive to what we have to say. They won't shut you down at the door. So I know in the Black communities, the church family, the people that are believe in God, that everything is put on this earth for them, they will understand that this is a good thing.
Yeah. Pastor Torres.
I agree with Sharon. You know, the only thing with Hispanic is that a high percentage of Hispanic elder people, their desire is to go back home and pass away there. Whenever we get together with families, we just flew to Oregon and we talk about it. And I told them, I said, listen, why spend so much money to send me back, you know, when all my family is here? Because a high percentage, I want to repeat that again, they want to go back to their country, you know. And a lot of times is because they don't have the information. And I do agree with Sharon, the church, the ministers, the pastors, but also every family, there is somebody that has authority, or there is somebody that has the power to influence, and that person can take care of that. Because we need to inform them, you know. We need to somehow get the information from a previous experience, you know, because otherwise they don't know what they're going to get if they go to a hospice, because misinformation, lack of information, maybe a previous experience from somebody, you know. But a lot of times it's just what people says, and they never have that experience, and they don't give the hospice the opportunity to prove that it's not what they heard or it's not what they think. But as a Hispanic, the church is going to make a big impact.
It has been said that in order to get information out to minority communities, must be done at 11 o'clock on Sunday morning. Many communities where there's no longer a newspaper, there's no longer a radio station, then the 11 o'clock hour, not only in minority churches, but in majority churches, come a time of getting information out to the entire community. So we all have work to do to make certain that people are aware of the services of Arkansas Hospice.
And Dr. Shepherd?
Yes, ma'am.
The doctor's offices, everyone goes to the doctor. Everyone goes to the dentist. Everyone goes to the OBGYN at one time. We have to get the information to the doctors to give out to the people way before they're terminally diagnosed with something that's life-threatening, and this is brought to them. Because if you give it to them in smaller doses, not when they're faced with a terminal illness and then you say hospice, because that takes away a lot of people's hope when you say, well, I'm going to refer you to hospice. So if doctors' offices would start, we get into those offices and start having them to educate the people on the benefits of hospice with a diagnosis of 6 months or less to live, that they offer services that will benefit you and your family. And you can stay home and you can be home. And then they have to educate them on the medications and what they're for. Because as soon as you say morphine, they shut down. And do you know morphine is a beautiful drug when someone is dying? When they are dying, and Ativan and the medication that dries up the secretions, these are great medications, but they don't accept it until you're standing at their bedside as a nurse and they see the effects of the medication. But then they're just looking for help for their loved one. But if they had the education long before that time, they would accept it, be more accepting to what hospice is all about.
Thank you.
Dr. Lewis?
Go right ahead.
Yes, I think, like I shared when we first started this panelist, the Chamber of Commerce, because we have leaders on the monthly Chamber of Commerce meeting. That was a great way to get to me 3 years later. A lot of people go to those meetings, people from the community, from the school districts, and for other business associations too. I think that would be a great way to continue informing and providing what they need to know about the hospice.
Thank you. A recent survey was conducted, and this percentage was really surprising to me. It said that 55% of people who were interviewed are not certain how hospice is paid for. 55% of people interviewed in a recent survey said they're not exactly sure how hospice is paid for. Who would like to start off with addressing this comment?
Sister Sharon?
I will. Yes, I will. Hospice is paid for just like anything else through Medicare, Medicaid, VA, indigent care. That's for people that don't have money. It's just like your insurance plans. You have access to it. Whether you don't have insurance, when you go to the AFDC office and you apply, you can get hospice care. But because people don't want to talk about it, they don't understand that they can have hospice care along with other services to make their dying well experience be the best experience that they could possibly have. So the information is not out there. That's why 55% of the people don't know how it's paid for. Arkansas Hospice is paid for, it's a nonprofit organization. So, and then you have other hospices out here that are for profit, but thank goodness this one is not. But it doesn't matter about that. All you have to do is ask, will my insurance cover hospice? Or am I eligible for hospice care? But if people don't want to talk about it, they're never going to know.
That's true. If they never talk about it, they won't know. One of the issues that we have on Hispanic community is that a high percentage of Hispanic does not have a Social Security number, so they're not able to get insurance. So they're even afraid to get the information, to ask about that, because they have an idea that they won't be getting the help they need. Probably about 3 or 4 years ago, somebody was getting pretty close, to die. The doctor told them, they was getting close. The decision that the family made was to send her back to her country. Unfortunately, she didn't make it all the way to her country. She passed away in Dallas, and no Social Security card, no residence, no a legal status, that it will change the whole scenario when somebody's getting close to that stage of dying. So the information for the Hispanic is very, very critical. A lot of times they don't even want to listen to you because of their status, but there is help. As a chaplain in the community, we work with a lot of people, a lot of families, and there is places where they can get help with their loved ones when they get into that stage of life. It's just the information to get it to them and change their way of thinking. Because somewhere, somehow, somebody told them something that is not true. There is help, there are resources out there, we just need to give it to them.
Thank you. Let's take another question here. We know that the fine work that hospice organizations do with assisting families for their loved ones to die well. But how can hospice organizations make more inroads and better serve our minority communities?
Well, what I can say is the way that I came across Arkansas Hospice, I went to a meeting at the Chamber of Commerce here in Walton, and they had a lot of businesses there. And because I have a love for hospice, I stopped at their table and I got associated with Rhonda. And that opened the door for me. So, and as we sat and talked, and I met with Kyle and another lady, which I'm sorry, I forgot her name. And we sat at McDonald's after the meeting and we talked about how minorities needed to be more involved. And I told her, it's going to take coming into these communities. They're going to have to come into these communities and educate these people and let them know what hospice has to offer them. And Rhonda and Kyle, they came to our church and did a presentation at our church right outside of Morton. And he lives in Arkadelphia. So it's going to take some hard work right now. And because of COVID-19, we're limited. So it's going to take more broadcasts like this. It's going to take more word getting out into the communities to get these doors open. But where there's a will, there is a way. And we have to reach into these communities with what they know, what gets their attention. And what gets their attention is people's presence. And that's what we need to do.
Yes, that's great. I think one of the things that we can do is to, the social media, is such a great tool to get to the community. But as a Hispanic, we need bilingual bulletins like the one they made. We need to get the information on their language. They usually have somebody, a relative, a son or daughter that speak English, but sometimes they don't want to read it. So if you put a bulletin on their hands, on their native language, they will read. There are more chances they will read it. If they get on English and they ask their grandkids or their kids to read it for them, the information somehow needs to get to them. And I think social media is such a great tool right now, because with COVID-19, we can't have meetings in our churches or big community centers or places like Chamber of Commerce. We gotta find a way to do it. But social media, it's such a handy tool during the pandemic.
And we know the pandemic has had a horrible effect on our ability to meet in person in large groups. But there are also a couple of other issues that we've had to face in our country, and that's racial as well as political tension. And my question to both of you is, does the current cultural climate, have an adverse effect on minority outreach regarding hospice care? How do you address current political, social, racial tensions that we feel and we see in the news every day and every evening in the broadcast?
I wish I had the answer for that one, but it is very hard. when you start talking about topics like culture, political, I mean, everybody's going to have their own way of thinking, but it does have an impact in the Hispanic community. You know, we have these people, they don't even care about political, you know, so they don't want to talk about it. They will shut their mind right away, you know, but then we have the ones that really we like to discuss or talk about it. And I'm going back again, it's lack of information a lot of times. They don't have the information they need, and they're not willing to listen sometimes, and they don't care, you know. And I wish it was different, but what happened is a lot of times people will come to this country and they say, well, I'm just going to go to the United States for 2 or 3 years and then I'm going to go back to my country. Well, guess what? That was my case. And it's been 35 years and I'm still here, you know. So it's very hard for me to answer that question.
Well, as for me, I can truly say in the Black African community, what's going on in the country is not affecting their outlook on hospice. That's two different things. They don't associate it because they don't want to talk about hospice. They don't want to talk about what's going on in the world when they're watching Black people being murdered on a daily basis. So I think the last time Cal and Rhonda talked to me about the minority percentage of minorities was like 3% that are involved in hospice. And I believe that since all this is going on, that number hasn't changed at all because that's not something in the forefront for people. Because now when people die, they're dying by themselves. They don't realize the hospice nurses are still working. The hospice care is still available to them. It's not on a scale like we want it because you can only have 1 or 2 visitors, but hospice is still working. And so I don't believe that because of what they're seeing on the news and what's going on and the racial tension has anything to do with hospice in their minds. So I feel like we need to let them know that hospice is alive and well and it's needed for their loved ones, especially if they get COVID-19. The nurses can still do their job through telemedicine and everything and make sure their loved ones are comfortable and dying well.
Thank you for your comments today and addressing the questions that have been raised concerning hospice and end-of-life care. Do you have any closing comments, either of you, that you would like to make to our viewing audience this evening?
Well, I would just like to thank hospice for the opportunity to be a person that has been with people and their families as someone they love has passed away. Because it's given me the greatest joys of my life to know that I was there to help the person who is transitioning, to speak to the family and keep them calm and to understand the dying process and to be able to give the medications that would make them comfortable and that they could watch me work and not be afraid and understand that I was there to make sure that their loved one was dying well. And that they would be okay with the process and that they did not have to deal with all of the signs. There's signs of dying. And we give them that book and we tell them months and months in advance, this is what you look for. But when you physically start to see them, it can be a scary process. But as long as you have that nurse there and she says, this is part of the dying process, they're not suffering. This is how they die, but let me show you that we're going to make them comfortable and we're going to be here for you and we're going to be here after they die. Sometimes they give counseling for a year or 2 years to the family after that loved one dies, and they can come in and they can get in group sessions on grieving and stuff like that. So it's more than just at that person's point of death. Hospice still remains in that family as long as they need them. And so to have the privilege and the honor to work with an organization that at the most crucial time in people's life that I could be a part of, I am so greatly appreciative of that.
Thank you. Pastor Torres, do you have any closing comments?
Thank you so much for allowing me to be part of this panel.
Well, tonight we have addressed the issue of Black, Brown, the challenge of dying well. Our panelists have both presented some unique opportunities and challenges for each of us as we continue to reach out to churches, physicians' offices, dentist offices, chambers of commerce, and the social media to remind people that they do not have to go through this alone, but there is an organization who can help them through this. I want to thank Pastor Torres and Ms. Ausler for serving as panelists today. And I want to thank the Russellville Fund for making this event possible. Viewers, would you please visit other pages of arkansashospice.org and feel free to call in or email in your questions. And we would like to remind you that this is the first of several forums that will be delivered throughout Arkansas through various regions of our community. And I would like to take a personal privilege of saying thank you for being asked to serve on the Arkansas Hospice Foundation Advisory Board. And it is a privilege and an honor to serve alongside distinguished colleagues who serve on the advisory board as well as within the organization. I want to thank the Reverend Kyle Jones, who's Minority Outreach Director for Hospice Foundation, for conducting this workshop, for pulling it together, and asking me to serve as facilitator for this evening. This concludes our program. Thank you, God bless you, and good night.